Welcome to this quick guide, offering 10 tips to help you lower the costs of cancer care.
In this guide, we cover ways to prepare for out-of-pocket costs associated with cancer care and treatment, tips to help you plan for future costs, ideas that might help you lower costs, and resources for financial aid and information.
While it is very hard to think about the costs of cancer care when you or your loved one is diagnosed, it's important to keep costs in mind. Service and treatment fees can pile up and often catch families by surprise. This quick guide is designed to help you plan for these expenses so that you can gain a bit of control and possibly lower your cancer treatment costs. This information may seem overwhelming at first. Even if you take just 1 or 2 tips from this guide, they may help you lower your cancer costs and hopefully allow you to focus on feeling better. You can use these tips as a resource and refer back to them over time.
Tip 1. Know your diagnosis and treatment plan. It's always important to learn the name and stage of your diagnosis. At the same time, ask about the treatments that you should prepare for now and into the future. This is also a fine time to ask about costs. For example, you can ask if you should prepare for surgery, radiation, chemotherapy, immunotherapy, or something else. You can ask when and where you will receive services, like if you'll need treatment for many months, or if treatment and recovery will take less time.
A treatment plan is a written document that outlines the treatment steps you will need to take and when. Often people just go along with what their healthcare team says. They don't realize that they can ask about a full schedule of appointments or scans over time, or the range of treatment options available. If your healthcare team hasn't given you a written treatment plan, ask for one. When you have a written treatment plan, it can help you understand what to expect and help you ask questions that can lower your costs.
Tip 2. Review your health insurance coverage. One of the first things that you should do when you're diagnosed is to call your health insurance and ask how their coverage works for cancer. Some plans have a low deductible and premium, but they also don't cover many cancer treatments. This is important for you to know. Ask what portion of bills you'll have to pay, or if there are limits to what is covered. Before you take tests, x-rays, or drugs, learn what will be covered by your health insurance. Learn if it matters where you get these services. Take notes or record these conversations with your health insurance and keep track of dates so you can refer back to them in case you have a dispute in the future. For lower costs, try to work with in-network providers who are covered by your health insurance, rather than out-of-network providers who aren't.
Tip 3. Use screening and wellness programs. Whether you already have cancer or you are concerned about yourself or a loved one, then it's important to ask about regular screening tests. With regular screening, cancer can be caught earlier and hopefully stopped with less expensive treatment. Stay on top of your cancer screening schedule to help reduce your cancer risks. Still, before you take any tests, check with your doctor that the tests are necessary and that the costs for screening will be paid by your health insurance.
Another important way to reduce problems from cancer is to pay attention to your health. Look for wellness programs that can help you stay as healthy as possible. Research has proven that eating a healthier diet, exercising regularly, losing weight, and reducing stress will help reduce cancer and other disease risks. You can ask your healthcare team about wellness programs. If you're interested in complementary approaches to treatment, get a referral and ask if your health insurance will cover the costs.
Tip 4. Choose physicians and facilities carefully. When you choose providers and cancer centers, consider working only with people and places that are covered by your health insurance. Try to choose providers who are experienced in treating your type of cancer. Ask your provider if you will need any services, like rehabilitation, that are not covered by your health insurance, so you can be prepared. Don't go to an emergency room for something that's not an emergency, since they are very expensive places. If you are uninsured, Ask if you can negotiate to lower fees for services. Bring someone with you to each appointment to help you take notes and ask questions as you prepare for treatment.
Tip 5. Get a second opinion. Don't be afraid to ask for a second opinion or an alternate treatment plan. This can help you learn about different treatment strategies that would be just as helpful but less costly. You are an important member of your healthcare team. You should be able to talk with your team about all parts of your care, including cost. If you feel like you're not being heard, you may want to ask for a second opinion. If you need to stay with a practice, ask if there's another staff member you can work with. The more you talk about these things with your healthcare team, your health insurance, and a financial advisor before you begin, the better you can prepare.
Tip 6. Be proactive about your health. Take care of yourself. Watch for changes in your health and how you feel. Talk to your healthcare team about treatment side effects and how to feel better. Follow directions to manage your symptoms as well as side effects. If you can, stay in control of other health issues like diabetes, heart problems, or your blood pressure. This way, you can prevent problems and additional or unexpected health expenses.
Tip 7. Stay organized. Managing life with cancer can be complicated. Keep important medical information in one easy-to-find place. Make a contact list of your doctor offices, hospitals, health insurance, pharmacy, and others helping you. Keep a calendar with medical appointments and treatment plan details, like when to take medicine and how much. Keep copies of test results, drug information, and notes about your symptoms. Keep dated notes about conversations with your health insurance so you can refer to it later if needed. By keeping this information organized and in one place, you can keep others up to date and stay aware of your expenses.
Tip 8. Track bills and what you spend. As you stay organized, it helps to create a spreadsheet to keep track of dates, services, fees, what you paid, and what insurers or others paid. Keeping track of your bills can help you remember when bills are due, especially when health insurance takes a long time to process them. It can also help you learn if there is a mistake on a bill. When you stay aware of your costs, it can save you from paying more than necessary. As you track your expenses, consider costs for related things like special foods, complimentary medicine, fertility treatment, help with cleaning, legal fees, or transportation. Also, if you can, don't use a credit card to pay for big medical expenses so you don't have to pay interest fees that build up. Instead, try to negotiate for a payment plan or lower price with the hospital or doctor's office.
Some people like to gather as much information as they can by trying a budgeting tool online. This could help you predict or calculate treatment costs in advance. The cancer support community and other patient organizations, insurers, or providers offer different versions of online budgeting tools. At any point, if you have a question about fees, you can always ask to review your bills with a billing specialist or financial navigator at your doctor's office or hospital. If coverage for a medical expense is denied by your health insurance, your doctor's office may be able to help you appeal the health insurance's decision.
Tip 9. Ask for help. Help can come from your health insurance, healthcare team, hospital financial navigators, family members, friends, an employee assistance program, drug company financial assistance programs, and local support groups. You can ask if you can negotiate a lower price before you use a treatment or service. It doesn't hurt to ask. It's easier to negotiate before using a service than after you receive a bill. You can schedule an appointment with a financial expert, an advisor, patient navigator, or care manager at your doctor's office. You don't have to do this alone. Don't be afraid to ask for help. If you're still not sure where to turn for help, you can call the Cancer Support Community's helpline. Professionals there can help you navigate financial issues, treatment decisions, and find resources to manage the costs of care.
Tip 10. Seek financial aid from foundations and other programs. Many people don't know that there are foundations and patient assistance programs that offer financial aid, grants, discounts for cancer medications, and other forms of financial support. To receive funds, you will often be asked to complete an application with your current and correct contact information, a provider's signature. Let them know you need them to sign the form. Applications may only be open to people with a specific diagnosis or income level. Check the instructions carefully, and all the information submitted on or before the deadline. For drug refill requests, submit the form early enough so that it can be processed in time. Keep copies of all completed forms for your records. If you don't need these resources now, keep in mind that these types of organizations are out there and available if you ever need them. For a list of organizations that offer financial assistance, see the Cancer Support Community's cost pages online.
We realize that it's hard to predict what to expect when it comes to cancer care costs. But there are questions you can ask, people you can turn to, and resources to help. With knowledge and planning, you can prepare for cancer treatment costs and may lower your costs for cancer care.
For more helpful resources, go to www.cancersupportcommunity.org/cost.